We are here with Dr. Stoller at Atlantic Health Systems, home of Atlantic Sports Health. Dr. Stoller, you are an expert in the field of concussions. You work with professional athletes from the New York Jets to Rutgers University, Seton Hall, high school kids, grade school, all the above. Can you define a concussion?
Sure.
What is it?
So a concussion is a trauma to the brain which does not leave permanent damage in a structural level. So I want you to imagine if the brain was surrounded by a jar of water, okay? And you shook that jar of water, the brain would move, but not necessarily have a blood clot ensue. In fact, when it moves fast enough against the skull, in a severe case, you can have what's called a subdural hematoma or epidural hematoma, where you do develop a blood clot. You don't have that with a concussion. A concussion is basically the brain is intact on a large level, but on a microscopic level, you have cellular changes that happen. And as a result of that, the brain is a little more irritable and excitable than it should be. On the same token, it's not as efficient. So things that normally would pass through electrical wiring as a rapid flow just kind of hit a little bit of traffic. So it's a strange thing that happens because you don't see anything on imaging. Everything looks great, but the patients suffer because this is happening on a microscopic level.
Yep. So in a way, by that, the brain in that glass of water, or the skull, if you will, it shakes around.
Yeah.
It hits a little bit too hard. Microscopic damage. You can't see it, but we know there's some cellular damage that took place.
That's right.
That would be a concussion.
That's true.
And we have to let that heal.
That's right.
By limiting movement of the brain, of the head.
Yeah, and in addition to physical limitations, we don't want to overload ourselves cognitively. Right. So this is a big piece of rehabilitation, recuperation, is that, patients basically have a concussion and within a day or two, they're like trying to go back to work full time or trying to go back to school full time or trying to sit on their tablet and scroll through and read a million things and answer a million emails. And, in 2022, we're bombarded by stimulation, whether it's computers or it's the family, the job, and sometimes we just have to take things and simplify them. And that allows the brain to kind of cool off and heal and enables those pathways and that electrical flow to go the right way.
That's so. How long does a concussion last typically?
It can range. It can be 2 days and it can be several years, and it depends on the patient.
Well,
Important thing. Yeah, and that delves into what we call post-concussion syndrome, which is over 90 days. Now, what's important is that we intervene early, and that we give the patient the perspective that by taking steps back and resting, I will move forward quicker as opposed to limping along. That's really an important thing. I use the analogy sometimes of rolling an ankle, which I know you guys see all the time, and in the orthopedic and athletic world. If you run on a twisted ankle, it just never heals, and the same goes with a concussion.
It's kind of like picking a scab. Never letting the scab heal, right?
To some degree.
Just an easier way to think about it. That's where you have to take that time out from the electronics, from that overstimulus, right? And physical activity, let it heal so it doesn't become a chronic thing and it's years, right?
It's true. And it's very rare for cases to go over 3 to 6 months. It can happen. Yeah. And it's unfortunate because I look at some of these patients, and if we had intervened earlier, could we have curtailed some of these symptoms?
Wow.
And that's an important point. And, for the parents out there, that's an important thing for your kids. If they miss a week or 2 or 3 of sports or 2 months of sports, in the long run, this will help their brain development. This will help their athletic development. They will be able to play sports the rest of their lives. But if they have too many concussions in too close of a period of time, it can hamper their growth intellectually, physically, and unfortunately, emotionally as well.
Yeah, and
all those things are
very scary. If you have too many in a short period of time, it can hamper all those things, and then sports will be out forever. So you're better off taking time off now, 2-3 weeks, even if it's a month, heal up 100% and come back even stronger.